Welcome to the InfoSec battlefield, where cyber threats and compliance converge. Here's your host, Carl B. Johnson.
Hello, listeners, and welcome back to InfoSec Battlefield. Today we have a special guest. Dr. Asante will be joining us, who will be talking with us about healthcare, HIPAA, and privacy, along with compliance. We are very honored to have him on our podcast. Dr. Asante and I have known each other for quite a while, so to have him here and to share some of his experience and knowledge over the years in the healthcare and the privacy and compliance side is a great honor. So without further ado, Dr. Asante, welcome to InfoSec Battlefield. How are you doing today?
I'm doing well. Thank you, Carl. Appreciate the invitation. Look forward to chatting with you.
Absolutely. And for our audiences that want to get more familiar with your background and your expertise, can you tell everyone about yourself?
Thank you, Carl. So I think you've already introduced me. My name is Robert Asante. As Carl mentioned, I have been in the healthcare field for over close to 25 years in different capacities. I also have a doctoral degree in higher education management. I have information security background, done some IT infrastructure work and support services. And I have some compliance background as well. So I look forward to chatting with you.
That is also, well, like I said, it's a great honor for you to be here with me. One, because I don't always like to talk to myself, so it's always great to have a guest to talk with. And two, I mean, you've been doing some great things in the privacy field and the compliance world. So I think just having you here and you being able to talk with us about that, I think it's just, the audience itself would appreciate that. Can you share with the listeners your journey into the world of healthcare cybersecurity?
Absolutely. So I started as help desk analyst, and then, of course, after a while, I decided that in order for me to move up, I have to do a little bit more than that. So I went to career schools, and I learned how to become a network engineer. So I became a network engineer. I did a lot of Cisco related configurations, firewalls, intrusion detections, and switching, creating VLANs, and designing virtual LANs and all that. I did that for a while, and then I also went and got my MBA in management information systems and financial management. Because I wanted to understand the business part of information technology. So I got my MBA, and then after that, I did research administration in academic medical institution for a while. And then after I've done that for a while, I fell in love with teaching, so I started teaching as an adjunct. I designed 2 courses. Information security and technology, and also design another course in healthcare information technology. Pretty much all the EMR and
Wow.
and all the related laws. So I did that. I designed the 2 courses, and then I taught it for a while. And while I was teaching, a couple of professors reached out to me. And they asked me, it seems like your student love you. Do you want to teach full time? So that is how I ended up at the University of Pennsylvania for my doctorate in higher education management. And then after that, Of course, I took a job as chief privacy officer in a very large healthcare system. So that's what I do right now.
Awesome. That's awesome. I guess why of all the different industries that you could have went into, why healthcare? Like why healthcare? Why not finance? Right? You're like with everyone else, and why healthcare?
No, that's an excellent question, and it's funny you are asking because I haven't had a lot of people ask me this question. So thank you for asking me that. So when I finished my MBA, after working as a research administrator for a while, I started my own consultancy. And because you are asking why healthcare, that's why I'm telling you this story. I consulted for one of the big banks in the country as information security compliance manager, right, for the bank, one of the big banks. It's in a multi, it's a global bank, right? So I did that for a while, for about 2 years. And then my former company called me to come back, right? So I went back to my former company to do privacy work. So while I was doing that, I realized that, you know what? In healthcare, there is a lot, when you talk about privacy, it is just more than fixing computers and writing letters to patients. It is more personal because in healthcare, patients, the way we look at privacy in healthcare is a little bit different than the way we look at privacy in the bank. For example, in the bank, if somebody found out that you have 1 million in the bank, it's not a big deal, right? But in healthcare, if somebody found out that you have a communicable disease or contagious disease, there's more stigma, right? So the bank cares more about, as much as they talk about confidentiality, they care more about the integrity of the data, right? So if working in the bank, if you take 0 out of somebody's $100, the person's level $10, right? Or if you add 0 to somebody who has $100, you've given the person $1,000.
Yeah,
right?
exactly.
So the integrity of the data in a bank, in the banking industry, is pretty much more the most important thing. But when it comes to healthcare, the integrity of the data is important, but the confidentiality and the privacy of the data is more, I would say, is more important because of the stigma attached to it. And that is how we build relationship and trust, with the patient and other stakeholders we work with. So that is pretty much the difference between the doing privacy in the healthcare or in other industries. In other industries compared to in the bank and other industries compared to healthcare. Healthcare is more personal and it is more consequential.
Awesome. And you and I have talked offline about this, and after talking with you, you really opened my eyes up because, again, from the InfoSec side and being a CISO, we mostly deal with, like you said, we mostly deal with data and making sure that there's not a data breach. But the information, if it's breached, is just the company's reputation. Not, like you said, you're talking about patients' information. One breach is one too many, right? In your world.
Absolutely. I think that's the best way to describe it. One breach is just too many, right? And I think, most. And here's the thing, Carl, you and I know who has 1 million and who has $5, right? We know the car you drive, we know where you live, we know where your children go to school, you know who you are, where you play golf, who you associate
Mm-hmm.
with. That alone gives us the profile of
Mm-hmm.
your financial profile, right? So there's not a lot of
Mm-hmm.
confidentiality about that. If somebody found out
Mm-hmm.
that you have 5 million in the bank, it's even a pride for you. But in healthcare, if somebody find out that you have communicable disease or contagious disease or something that you don't want somebody to know, it may even make it difficult for you to get a job. It may make it difficult for you to keep your network of friendships, or even
Mm-hmm.
sometimes even your own family network and stuff like that. So for me, I take it extremely personal, and that's why
Yeah.
one of the reasons why doing privacy in healthcare is so important to me. Yeah.
Yeah, and I would say, speaking on the business side of it, it's not going away, right? Like you said before. I mean, it's not. Healthcare is getting larger and larger. You see Amazon and different organizations getting involved in the data of healthcare, and it's like you don't you we hear about all the advancements, but we don't necessarily hear about the privacy side, right? And
Yep.
so I think what you're doing is great work. You know, you're the Superman of healthcare privacy. That's
Yeah, now I think you said something very
it.
important. Healthcare
With,
is not
with,
going away. Healthcare is not going away. It's here to stay. Healthcare it's been very challenging, I can tell you, since COVID and even post-COVID. With COVID is still hanging around. But healthcare is extremely challenging. There's been a lot of consolidation on the business side of things. A lot of, healthcare organizations being bought. There's been some even closing their doors to some of the critical
Mhm,
services that the community needs. Um, some healthcare businesses can, keep their
mhm,
positive, balance sheet and stuff like that. So, so it's been extremely challenging for healthcare overall. But what happens is that when you're dealing with the fiscal aspect of healthcare, sometimes people ignore, in some cases, because the attention is focused on balancing the books and keeping the operation going. And sometimes, prioritizing the privacy and the security can sometimes become
mhm.
afterthought to some degree. But I think that is why
Yeah,
this is a good time for us to be able to continue on to work with the leaders in healthcare, and um, information security providers like your Clear Systems and other institutions, to make sure that we have the government, of course, the state agencies, to make sure that we have the appropriate support, system in place for healthcare overall, and so that we can continue on to safeguard the privacy of patients, which is, to me, which I think is something that needs to be prioritized.
absolutely. I couldn't say it better myself. And uh, yeah, as you were speaking, I was thinking we have to be very careful with data. Like we say, oh well, there's so many advancements in technology. We have to be careful what we wish for, because the advancements in technology when it comes to healthcare comes at a price, which is a great segue into my next question. What are some of the most pressing challenges you have encountered in safeguarding healthcare data?
So I think on the privacy side, some of the challenge is the evolving. As you know, there are many state laws coming up, right? Privacy. There's no, other than HIPAA, right? We don't really have a national privacy, like laws similar to GDPR and others. Of course, California came out with,
Hmm.
CCPA, CPRA, the California Consumer Protection, but I would say that we've seen a lot of states coming up, some states coming up with, privacy laws, right? And so for us as a
hmm
covered entity under HIPAA, when a breach happens, you're not only dealing with the federal, the reporting obligation that we have to the federal government, to Office for Civil Rights and HHS, but we are also dealing with the state responsibility obligations, right? So that is in itself is a challenge. And if you have patients who live in different states other than the state where the hospital is, you have to notify based on the state's notification requirements of where those individuals live. So that in itself is a challenge. The other challenge that we have other than that is that healthcare overall is extremely complex, right? Healthcare is one of the industries that has a decentralized structure, right? Or decentralized organizational structure. So when you have a decentralized organizational structure, as privacy officer or a compliance officer, your job is to make sure that there is alignment, right, among all the various units, right? So you have Department of Surgery, you have dermatology, cardiology, you have the textiles group, you have cafeteria services, you have IT, you have HR, you have supply chain, you have pharmacy. So there are many, many units within the operation, right? And you have to make sure that when you are training and you are protecting the privacy, it's not just the patient, but it's also the employees and all the stakeholders, the vendors, they provide different services. So it is a very complex environment, and you always have to make sure that one, you cut your coat according to your size, but also make sure that you are creating an alignment and accountability, within the process. And that's some of the reasons why privacy in healthcare is a little bit challenging and complex compared to the other industries.
Yeah. And, it's funny. As soon as you said supply chain management, I can only imagine what that looks like you said, across all of these different departments. You're dealing with thousands of different vendors,
Oh,
and we're not just talking about one vendor here or one here. I mean,
yeah. Oh no, it was, you have cafeteria services alone is a whole business, right? Right. We need to get the food in, right? We need to
mhm,
get a lot of services in textiles, right? We changing
yeah.
blankets, we changing pillowcase, we changing, sheets in the inpatient settings, and we have to do laundry. We have laundry services, different all that. The pharmacy services, right? Medication needs to come in, right? Biomedical engineering, right? All the various durable
hmm
medical equipment and different types of supplies that we need for all the various departments, the OR, right? The different tools that are needed for
hmm
surgery and for other services. So supply chain alone, we can, I think maybe one of these is, Carl, we should find some time and choose one specific area in healthcare and talk about it, because I think there's a lot of opportunity here for us to explore how privacy impacts some of these units
Yeah,
within
absolutely.
healthcare operation. And I look forward to doing that with you.
Absolutely. Yeah, I think we can easily spend, just like you said, hours just on one department. I mean, I was looking at the on the news recently, where the MRI, the MRI machine, and the basically whoever the technician wasn't trained correctly, and caused an injury to a patient, because the patient had metal on and different things like that. And I saw that, and I thought to myself, that's training, right? And a lot of what has to do in the medical and the healthcare industry is if the personnel is not trained right, whether we're talking about from something like this, a machine, MRI machine, even down to privacy of them understanding, how to deal with patient's information. Any case we put can be a disaster for the patient. So it's such a large subject that can easily be covered on so many different areas.
Absolutely. And some of these devices that you're mentioning, MRI, some of these devices that has operating systems, right? There are operating systems. So there's technology aspect of it as well. And healthcare workers, it's a very busy place, right? Especially if you go to the ER. The ER is a very, very busy place. The OR is also another busy place, right? So when people are busy and doctors are focusing on saving life, right? The priority becomes saving life, of course, and that's what should happen. So how do you work with all these constituencies, right? All these stakeholders, right? Who have priority, in other areas, and how do you still find a way to build an alignment and partnership and have them understand that even in the most busiest time of the day, right, at the OR or at the emergency department, they should also think about patient privacy while they're saving life and and doing all that. I think there is a lot that goes on in a hospital. I think people understand what it takes to maintain all the various pieces while still saving life.
Absolutely. And one of the things I wanted to talk to you about is the big elephant in the room, and that big elephant in the room is AI, right? Because we were talking about saving life. We hear how AI is. There's so many solutions about using AI to help save lives, and whether we're talking about cancer or early detection. I mean, for you, from the privacy side, I mean, how do you feel about AI in healthcare? I mean, what is your opinion about AI in healthcare?
Well, I think there's a lot of work that needs to be done before healthcare overall adopts AI. But let me put it this way: let's be clear about it. AI has existed for many years, right? This is not new, right? The use of artificial, intelligence in healthcare has existed for a while. I think with ChatGPT, OpenAI, becoming known to everybody, I think it is creating a lot of conversation, and everybody is, starting to think about, how to create a program, AI program within their organizations. My organization, for example, has had innovation department for a very long time. We've done a lot of, complex stuff with regard to, artificial intelligence. We use a lot of robots in our hospital. So automation, if you want to think of AI in terms of automation, has existed. I think now that everybody is aware, from senior leadership, middle managers to the assembly line, now that everybody is aware of artificial intelligence, I think it is important to create a framework, a program, right? If I may say that, our healthcare organization are supposed to have policies about how they use AI. They can't use AI in silos as they've done in the past, right? It has to be something that the organization has evaluated, assessed, and sanctioned and approved that these type of AI should be used within the organization. So AI, something as simple as Grammarly, that is AI to some degree, right? A lot of, if you go to academic medical institutions where there are a
Mhm.
lot of researchers, a lot of people publishing, a lot of publishers use, they use Grammarly to edit their documents and also to ensure that they are keeping up with the work that they need to do. That's a form of AI. But I think we need to move from,
Mhm.
silo AIs and ensure that, large language models just don't stay where they are. They become foundations, right? And then from the foundations, then we can have generative AI to the
Mhm.
extent that, you can take data and ensure that you can be able to um, generate or ask for information about the data that you have. But I think healthcare can benefit hugely from AI because
Yeah.
of the complex um, amount of information we deal with, from coding and documentation, from education, from home health services, hospital at home, and different services. I think there's a huge benefit if hospitals can adopt it.
Absolutely. And you said it right. I think with AI, as long as we have uh just like any new technology, we have to have some kind of boundaries and some kind of law, right? It can't be the wild wild west that you have doctors typing in, how do I fix this on this patient, right? There has to be some kind of boundary and rules in place, so that it's controlled. It's kind of like what we look at how the internet was at the very beginning, right? And then they finally put some controls in place because people will be people, right? So you most definitely have to have some kind of bumper guards in place when we're talking about AI, and especially with healthcare and patient information.
Yeah. Now, I mean, here are some statistics for you, some based on some reading that I've been doing. The National Bureau of Economic Research said that AI can reduce healthcare expenditure by 5 to 6%. That translates to about 200 to 360 billion, right? In savings, right?
Wow.
It is Fox News did say that FDA has approved close to 500 and 540 applications that can be used to read, cardiology and radiology images, right? 400 of that 540 alone were radiology images, and they said they mentioned that it was very efficient to some degree. Of course, AI has hallucination, so for complex cases, of course, the efficiency was somewhere around 50%. But I think with oversight, you realize that there's opportunity there. The Boston Consulting Group did some work with the Blue Cross in Boston, and they found out that using AI, they were able to achieve to 10, efficiency in claim processing, in processing claims. These are significant, achievements, or these are significant numbers. And I believe that overall, the consensus is that with AI, efficiency is there's opportunity for more efficiency. So I think there is opportunity here for healthcare, and we have to look into it. Now, healthcare is a very complex area. So unlike other industries, we can't just jump into the water without at least first dipping our toes into it before
Yeah.
we jump into it. So we have to be very
Mhm.
careful. But I think with leadership and appropriate program, AI program, I think healthcare will benefit immensely from the use of AI.
Awesome. Awesome. Well, Dr. Asante, I mean, this has been a great conversation. I want to continue. I think you and I, because we talk offline, we can go for hours talking about these things. So we're both passionate about this area of, especially of AI, privacy, compliance, cybersecurity. But I know your time is limited, and I know we wanted to do a series of this later on. So I'm going to invite you back on to the InfoSec battlefield to discuss this further. Thank you very much for being with us today, and have a great weekend. And I will see you soon.
Thank you, Carl. Appreciate the opportunity. I look forward to chatting with you in the future. Thanks a lot.
Thanks for listening to this episode of InfoSec Battlefield, where defense meets the digital domain. Make sure to like and subscribe on your favorite podcast platform so that you never miss an episode.